Welcome to Every Animal Has an Owner, a mostly large animal podcast for veterinarians and the people that depend on them.
If you don't know what it is, then you can't manage what you're trying to treat or to prevent. And so the diagnostics in other in other species such as poultry and swine, diagnostics are ongoing and a well understood need for the industry for having ongoing surveillance on a regular basis so that they can manage any disease challenges that those animals are dealing with. In the cattle industry, it's only in its infancy to be using large-scale surveillance diagnostics, and it is coming forward in the last few years and will continue to get better over the next few years as far as how much we jump in and use a diagnostic process to determine the cause of the disease and then create a better intervention, usually in the way of a vaccine that we can use on future herds. Well, in diagnosing BRD, it used to be typical that you would wait, and then if a calf died, then you would do a postmortem, collect samples of all the lung and the tissues that are affected by the respiratory diseases and send those to a lab, and the lab would determine what your diseases were. And then eventually we started doing where we could do a culture of the back of the throat so we're doing nasopharyngeal swabs where we could do that, and then we get a bacterial culture to see if we could identify the bacteria, and then also get a sensitivity of the bacteria to antibiotics so we know which antibiotic to use. But more recently, and in recent years, the improvement in the molecular diagnostics, meaning that we can do a DNA test, and we can do it very early in the process because those DNA tests have become so precise that we can take a nasal swab or a pharyngeal swab the day the animal arrives at the feedlot or at any other stage of production. We can simply grab those samples. We can do the same thing with feces. And even on feces, you don't have to catch the animal. You just pick it up when they drop it. And we can send those in for a very early diagnosis to a diagnostic lab. And we can have an answer in 24 hours as to what viruses those and or bacteria those animals are dealing with. And we can have it done before they get sick and have an answer and be prepared to intervene. So if we diagnosing, when we're trying to do a diagnosis and we diagnose the typical IBR, BVD, or a BRSV and a PI3, which is where the traditional vaccines have been, we can utilize those vaccines and prevent these diseases very well. And now, in recent years, the diagnostics labs have shown that IBR, BVD, and to some extent BRSV has decreased in the finding it simply because we do such a good job of vaccination with effective vaccines. The problem is that now that we have the ability to find other things with these sophisticated diagnostic molecular tests, then we have a disease that we can identify that there's not any commercial vaccine available, but we can take those and get a gene sequence of those new organisms, and we can, from that gene sequence, put that into a vector and create a subunit vaccine specific to not only that new disease, but to the strain that we found in that animal. And the precision is unbelievable in how we can take a diagnosis from the beginning and take it up through the system and create a vaccine that is not available anywhere else and is precise to the exact strain of the virus that we have found.